Welcome back to Q13 News. So the question this morning is gun violence in this country a public health crisis, or is it strictly an issue of gun rights? We're talking about this because last week the NRA tried to tell doctors to butt out of the debate, and doctors across the country in many cases have been responding pretty passionately on social media. So let's walk back just a little bit and tell you where this all started. It was after doctors on the American College of Physicians Health and Public Policy Committee wrote this position paper. They were advocating for the need to basically consider gun deaths and injuries in our country in this way as a public health crisis. And that in the U.S., we really need to strengthen policies that do treat it that way to combat gun violence. Now, in response to that paper, the National Rifle Association, or the NRA, responded by posting its own article and then tweeting that doctors, quote, self-important anti-gun doctors stay in their own lane. The tweet goes on to talk about how the medical community continues to do this and doesn't consult anyone else but themselves. So the NRA's response here has prompted a lot of doctors in our area, across the country, to speak out about the times that they have had to deal with gun violence. And some of them have been posting pretty graphic photos, bloody photos of themselves treating patients. Dr. Elizabeth Meade, one of our friends on the show, thank you for being here. You've been one of the doctors who has stood up, and you have actually shared your thoughts about this. Would you just tell us what your response to the NRA has been?
Yeah, I think that this evoked such a passionate response from physicians because we, along with EMTs and firefighters and other first responders, nurses and police officers, really do see the effects of this firsthand. So I think that when you have personally cared for a patient that has been shot and have seen that devastation, it's hard not to speak out and say this actually really does matter to us and we should be part of the conversation.
So what did you say when you saw that, and how did you react publicly?
I was very frustrated. I think like many physicians, my response was this really is our lane, and this is something that we not only feel passionately about, but that we deal with every single day. I think that this tweet by the NRA really contributes to this culture of contention, which is not helpful in moving this issue forward. And really, we need to look at this as a public health crisis and address it just like we do car accident fatalities, swimming pool drownings, all sorts of things that affect people.
And you're actually part of a local organization that has made this a priority. I mean, it's kind of been on the forefront of saying gun violence should be considered a public health issue.
Absolutely, and I think that was the other part of the frustration in response to this tweet, was that to say that we don't consult anyone else just isn't factual. So I think physicians are desperate, actually, to work with gun manufacturers, gun sellers, and the NRA to really come up with answers to this problem as a community together.
And there are innovative approaches in this community. I mean, there are gun store owners who are working with doctors when it comes to trying to prevent suicides, for example. There are lots of examples of working together to solve this issue.
That's right, and it really is a public health issue. I mean, if we think about the numbers here, 342 people are shot in this country every single day, and 47 of those are kids and teenagers. So if there was anything else that was affecting that many people, killing or harming that many people every single day, like the flu, like all sorts of things that we take a public health approach to, why should this be any different? And I think that's really how physicians feel.
This is clearly a personal issue for you. Could I ask about your personal experience when it comes to this?
Yeah, I mean, without getting too graphic on morning television, I've cared for lots of kids that have been shot, that have been killed, paralyzed from firearms, either from intentional or unintentional injuries. And I think from a pediatrician perspective, we worry not just about intentional shootings, but certainly kids finding guns that are not safely stored in the home. I think that once you've had that experience, you are forever changed. And you can never go back to seeing this as something that doesn't affect your community and your family.
I want to take a little bit of the political, maybe heatedness out of this, or the passion out of it, and just ask, could the NRA have a point here that maybe doctors are anti-gun and could listen to, to their perspective? What do you think about that?
Well, I think doctors would love to sit down with the NRA and really have some productive conversations about how to keep people safe in this country. To say that we're anti-gun is just not true. Doctors are not anti-gun, they are anti-preventable death. And I think it's a really important distinction to make, that we fully understand as a medical community that people have the right to own arms and to own them safely and responsibly. There are many physicians who responded to this who are gun owners themselves and who really said, this isn't a political question, we're not anti-gun, but what we are anti is anti-kids and adults getting killed and harmed that could be preventable.
This is certainly has a lot of people talking, and some of the tweets are difficult to read.
They are.
Photos, certainly. Do you think it actually helps? Do you think this pushes the conversation forward, or is this just another political debate that we're all going to forget by next week?
I don't think that the original tweet by the NRA helped, because I think, again, it really contributes to that culture of divisiveness and sort of contention. But I think that the response from physicians is helpful in the sense that it allows people to see the sorts of things that we're dealing with every single day, and to really understand why we are so passionate about this issue, that it's not about politics, it's not about rhetoric, it's about saving lives of the people that we care for.
Dr. Elizabeth Meade, thank you very much for being so honest with us this morning. We really appreciate it.